what is it that we want? Do we want a nanny state that will chase us down so we can get our vaccines? Or do we want a country that will keep the CT scan away from our hospital near a ski resort so that if I get bonked in the head, I won't be able to get a CT scan? Choice is yours. You go Bernie Sanders route, you'll get Canada. You'll go the conservative route, free market route, and you'll get excellent care, particularly and most especially when you need it. That's as simple as that. So Bernie Sanders knows this. How do I know that Bernie Sanders knows this? Because apparently there's something called the Bernie Sanders Show. And I stumbled upon that Bernie Sanders Show. And here he is interviewing a Canadian physician.
So, if people get seriously sick in Canada, they have a heart attack or a cancer diagnosis or whatever, our outcomes are excellent for those serious conditions, and we don't wait any longer than anybody else in the world for those important things.
Okay, we don't wait any more than anybody else for those serious things, for those serious conditions. What's a serious condition? I mean, a serious condition could be a heart attack. I think most of us would agree that it is. But how about claudications? Chronic pain in your leg related to the fact that you're not getting enough blood supply to your leg. How about a condition, a mental health condition, where you're not completely suicidal, but you may be losing control of your life? Is that a serious condition? It's really dangerous, really, really dangerous when the government defines what a serious condition is. Isn't it better for you to define what a serious condition is? And if you can't, and if it isn't completely under your power to define what a serious condition is, isn't it better if you and your contracted third payer were directly involved in negotiations over what a serious condition is or is not? Especially if you have the ability to confront them and to argue your case if they disagree with you. The worst possible thing that you can do is to allow these incredibly serious decisions that involve your life and your personal well-being to put them in the hands of the government. That is the absolute worst. And even worse than putting them in the hands of the government is putting them in the hands of a government that's 2 or 3 times removed from you, i.e. the federal government. Let's listen to a little bit more between the conversation between this Dr. Danielle Martin and Bernie Sanders regarding the waiting times in Canada.
Having said that, we do have a problem with wait times for what we call elective or non-urgent procedures. So people who are waiting to see a specialist for a non-urgent issue.
Give us some examples.
So if I have a patient who has headaches and want the opinion of a neurologist about the management of their migraines, for example. Not because I'm worried that they have brain cancer. If I'm worried they have brain cancer, they'll get their MRI tomorrow, and the system will move very quickly. But if I have a patient who's got migraines and I need advice about how to manage it, they might wait several months to see a neurologist for a non-urgent problem like that, or non-urgent surgeries, the classic example being a hip or a knee replacement.
So how long will it take me in the end?
It depends on where you are in the country. Sometimes it's a few months, sometimes it's a year. In some places, sometimes it's been even longer than that people wait for a hip or a knee replacement. And I think that's totally unacceptable.
I'm glad she thinks it's totally unacceptable, but she's defending government-based health care to the United States with none other than Bernie Sanders. Look, I see these patients all the time from Canada. In Florida, I'm in the opposite extreme of the East Coast. And yet, during the winter months, when Canadians come over to vacation, they'll come and see me over their hip arthritis. Why will they come and see me over their hip arthritis? And they'll pay out of pocket. They'll pay out of their own pocket. Why? Because I'm sorry, doctor, but I won't be able to have an appointment in Canada for another 8 months just to see the orthopedic surgeon. I'm sorry, sir, just to see the orthopedic surgeon? Yeah, just to see the orthopedic surgeon. How long will it be before you can have your actual hip replacement. Oh, a year and a half, maybe 2 years, sometimes 3. Is that really the type of care you want in the United States? Is that really the type of care that you even want to place yourself in the position of having in the United States? Because the only reason they're having these issues in Canada is because Canada is rationing the care. And if you give this to the federal government, they will ration your care. Why? Because your care costs money, and the money affects the budget. And a good way of cutting the budget is to keep you from getting the care. And by the way, how are Canadians going to get any care if we ration American care? It's a serious problem. By the way, what did she say? A few months before you can see a neurologist for a migraine? How about the patient who's suffering from the migraine? Can you imagine going a few months without seeing a neurologist for help on your migraine merely because the government has not arranged for a manner in which you can get access to that care sooner? So for the government, a serious condition does not include a migraine. Do you think a serious condition would be in your list if you had a migraine? I bet you it would. I bet you would if you were the one having the migraine at the time that you were having the migraine. This is why the free market is so important for healthcare. The reason why the free market is so important for healthcare is because nobody can prioritize your care the way you can. And the worst thing that you can do is to give that authority to somebody else. It's bad enough that in this country, so many of us are forced to give those decisions up to an insurer. Could you imagine how much worse it would be if you gave it up to the federal government, who has, number one, the power of the gun, and number two, doesn't have any competition? I shudder at the thought. I don't even know why we're even discussing this. One more thing I got to share with you, because to me, the first time I heard this situation was just incredible. But it happened, and it continues to happen, and it will happen again this winter. A Canadian breaks his hip, or her hip. She's in the emergency room here in the United States with a broken hip. Can you imagine how painful it is to have a broken hip? They can't even roll you in bed to clean your bottom because it's so painful. Okay? So what do? I evaluate the patient. I see if the patient is ready to go. Patient's ready to go. Doesn't need a cardiac catheterization or anything like that. And I decide, okay, you know what? We're going to do the hip surgery to stabilize your hip tomorrow, or maybe tonight. I don't know. It depends on what time you came in. I immediately get a phone call from the Canadian insurance company. We would like you to fly the patient to Canada. Yeah, we would like you to fly the patient to Canada. Are you kidding me? Yes, no, we would like you to fly, because if it's not an emergency, if the patient is not stable, if the patient is not unstable, we would like you to fly her to Canada. Is the patient unstable? Well, her blood pressure is fine. She's breathing well. She's in bed, so she's not going to fall. So I can't call her unstable. Well, then we want you to fly her to Canada. Are you serious? Yeah. As a matter of fact, we'll bring an ambulance plane at the cost of what? Over $100,000 maybe? We'll bring you an ambulance plane to pick her up, and we will fly her to Canada. To which I say, no, that's inhumane. It's inhumane treatment. But that's exactly what the insurance company wants to do in Canada. Why? Because they're run by the government. They're run by the government, people. These are the decisions that they're going to make against your will if you give them this authority. You cannot, under any circumstances, give them this authority. How does it resolve? I'll tell you how it resolves. Here's what I tell them. I tell them, look, you can fly them to Canada if you want. You're going to do it under the license of one of your doctors. I am not signing that order. And if you find a doctor that is willing to sign that this patient should be airlifted to Canada from Florida when she could have her hip fixated right here without a problem, and then you can take her wherever you want, then okay, you can do it. You can do it on your license. Guess what? They haven't signed yet. Why? Because the doctors know this is a coercion and an intimidation that's done only by the insurers. Why? Because the government wants to save money in Canada at the expense of your care. That's why this happens. So Listen to her explanation as to why this waiting time is taking place in Canada.
What we have determined, and those of us who study these issues and work on these issues, is that although those waits are a problem, they are not caused by the fact that our insurance plan is paid for by the government. The reason that we have difficulties with waits is because we have done a poor job of organizing the delivery systems of care.
It's not the fact that the government is paying for it. It's that we've done a poor job at organizing the delivery system. Well, who organizes the delivery system? Who makes the decision that as a matter of policy, we're going to fly patients out of Florida with broken hips without them being fixed over to Canada? Who makes the decision that we're not going to put a CT scan in near a ski resort? Look, the delivery system doesn't just spontaneously happen. It is created by the government in Canada. In the United States, who creates it? Well, to some extent, and in my opinion, to an insufficient extent, the delivery system is created by good old-fashioned competition. Whoever is more ready and whoever can deliver the more efficient care at the best cost wins. That's why if you need a hip replacement in the United States, as a matter of fact, if you need a hip replacement in Venice, Florida, and you're cleared, I can do it for you next week. No questions asked. In Canada, it'll take you a year and a half. My name is Dr. Julio Gonzalez, and you're listening to the Federalist Pages.